Welcome to the Happy Bones, Happy Life podcast. I'm Margie Bissinger, a physical therapist and integrative health coach, and I am your host and guide on our journey to discover the keys to stronger bones, more happiness, and the secrets to live your best life ever. From nutrition to stress, from exercise to happiness, you will gain revolutionary insights from our leading experts. It is time for you to discover the health and happiness you deserve. Hey, Margie here. Are you ready to learn something new about your bones and delve into some of the root causes of bone loss? Well, if you answered yes, then you are in the right place, because our guest today is Dr. Tim Jackson. And Dr. Tim, I call a man of knowledge because he knows so much about so many topics. But today we're focusing on osteoporosis and our bones. And Dr. Tim's a physical therapist, but he's also educated in nutritional biochemistry, digestive health and its systemic effects, functional endocrinology, epigenetics, and autoimmune and neuroimmune disorders. He's been featured in the Huffington Post, as well as countless health and wellness summits. And he's on the advisory board for the International Academy of Functional Medicine and Human Nutrition. He consults with various medical practices across the country about helping them incorporate functional medicine into their clinics. In today's talk, we delve into the gut, the role of homocysteine, like what does that mean when that comes back on a blood test, as well as vitamins, supplements, and so much more. So stay tuned. Welcome, Dr. Tim. I'm so excited to have you here today. This is really a privilege for all of us because you are a man of knowledge. I'm always impressed how much you know. So I'm really thrilled that you're joining us and to really enlighten us with all of your great information. And it's interesting.
Thank you so much for having me. It's, a pleasure to be here. And hopefully I can share some action tips and useful knowledge for your followers and the listeners.
That's fantastic. But I love that we share a little bit of a common background because I'm a physical therapist. That was my very first degree that I got and how I started practicing. And you started the same way. And I think we both sort of realized that physical therapy is fabulous and we can really help the body, but it's one unit, the mind, body. It all is connected. So why don't you a little bit share your story so people can appreciate how you got into this field and all the things you're doing besides physical therapy?
Yeah, so I came from a very traditional medical background, meaning that, I graduated valedictorian in my high school. I went to Wake Forest University in North Carolina, which is a top 30, top 25 university. And I did very well academically there. I did the whole pre-med curriculum. And I did a lot of preceptorships at the Wake Forest School of Medicine, formerly known as the Bowman Gray School of Medicine. And some of the doctors, they were like, you could go to a traditional medical school and get your MD. Academically, that's not an issue, but you're going to be bored to death. And I had gotten into nutrition and exercise at that point. And one of the ER attendings, he pulled me aside and he's like, listen, just get a ticket to play the game. And I was like, what are you talking about? And he said, you don't need to be an MD. Just get a degree in some health-related field and just play the game. And so that was kind of like a slap in the face. And then I had mono prior to my senior year. And, their doctors recommended, I take the semester off. But being the type A person I am, I said, no, the heck with you. I'm going back. And not only did I go back, but I was, a TA, gross anatomy. I was a resident advisor. I was a tour guide. I was a tutor. And so I was burning the candle at both ends. And then I had oral surgery, which, I now know was unnecessary. But at the time they told me, if you don't have this surgery, you won't have any teeth by the time you're 30 years old, which was just a bullying technique, because I have friends now who are oral surgeons. And that surgery turned out to be like an 8 or 8.5 hour surgery. And they put 26 titanium screws and 6 titanium plates in my mouth.
Oh, my.
And so it was very barbaric. And I came out of it just, not really able to recover. It was kind of the proverbial straw that broke the camel's back, so to speak. And so I said, okay, I graduated with, a very high GPA and was going to go to medical school and get my MD. But I said, I'll take the year off, try to recover from this surgery. And at that time, I basically, people told me to go see a psychiatrist, that, that there was nothing wrong with the surgery, that there couldn't possibly be an immune reaction to the materials used. Now they have tests that you can use to check for that. But I ended up, finding an ENT or an allergist who was about to retire. And I'd been put on rounds and rounds of very strong antibiotics from the time I was a child through adulthood for middle ear infections. And so I had a very high load of candida. I had a pretty high viral load and heavy metals. And so I got treated for that. I got somewhat better enough to, go and get my doctorate in physical therapy. I wanted to get a doctorate in some health-related field that I could, do some sort of manual therapy. And, if I had to do it over again, I'd probably go to chiropractic school because, PT, you either do manual therapy or you don't. And I wanted all manual therapy. That's really the only thing I was interested in. And I was studying functional medicine the whole time I was getting my doctorate, because I knew, from my own personal experience, that there were so many other factors that influenced health besides what textbooks said and, quote unquote, evidence-based medicine said. And so, I just continued to study functional medicine. When I graduated, my first job was working with at an orthopedic outpatient clinic in Charlotte, North Carolina. And I noticed several trends, one being that, most people with frozen shoulder almost always have either overt hypothyroidism or subclinical hypothyroidism. And
Wait, let's just stop there for a minute. That's such a good tip for everybody. If you have frozen shoulder and it's not getting better, because typically people with frozen shoulder are just sent to physical therapy, and many times that's all it is that they've injured their shoulder. But continue, because I think this is a good point. There might be some underlying root cause.
Yeah, a lot of what happens are simply external manifestations of internal imbalances. So external manifestations of internal imbalances, meaning that anything that is a stressor internally can manifest as an external sign. For example, mold toxicity typically affects the small joints of the wrist and the hand, whereas Lyme disease, for example, typically affects the shoulders, the hips, and the knees. So, those are, patterns that I began to see. Also, I started studying the work of one of my mentors, Dr. Alex Vasquez. I came across studies showing that people with bilateral knee pain, they found mycoplasma antigen antibody complexes in the synovial fluid. And so I was like, well, why am I jamming my thumb or using these Grafton tools in people's knees? I mean, it's really doing them a disservice. I mean, I can do it and it might, give them some temporary relief, but at the end of the day, it's not addressing any root cause. And so, all of those trends really just drove me to say, okay, this is BS, this is BS, this is BS. And I think it's important for everyone to be a divergent thinker. And what I mean by that is that you evaluate situations and information independently of what everyone else is doing. So it doesn't matter if 200,000 people are jumping off a cliff, you need to just sit there and decide, okay, does this make sense? For example, prescribing antibiotics for a viral infection. That just doesn't make sense. I mean,
exactly.
Just the name. If people would just stop, I mean, it's not that hard, just some of the basic stuff. And so that really set me down the path of functional medicine.
Great. Now that's really great because, and taking that to osteoporosis, this is what I see all the time. You need to figure out the root cause, what's going on with your body. The bones are not an isolated part. The bones are part of the whole system. And so to me, it's their entry point. Like when I see someone with osteoporosis, that's just their entry point. What else is going on? And so I love that that's your approach as well. So yeah. Why don't we start? We're going to start with some things that other people haven't talked about because I just love that you're such a research person and you're a person that really just has a wealth of knowledge to help us. So let's start with homocysteine. Why don't you explain what it is and why that can impact our bones? Because most people wouldn't even think that that would have anything to do with their osteoporosis or their bone health. So why don't we start there with what it is, where people find it, and just maybe start with that.
Yeah, so homocysteine is a marker typically checked for cardiovascular health. If it's elevated, it can damage the endothelial lining of your blood vessels and also cause damage to the heart itself, the heart muscle. And so typically doctors, practitioners, providers will check it in that regard, because if it's elevated, it's a sign of inflammation, and particularly in the cardiovascular system. But studies have shown that it can also lead to decreased bone density. And so homocysteine is part of a larger cycle called the methylation cycle, which involves B12, methylfolate, and the other B vitamins as cofactors. And so homocysteine, we certainly want to still look at it for cardiovascular risk, but we also want to look at it in terms of, hey, this may be contributing to decreased bone density.
Great. And so if it is, what would you recommend?
Typically you want to take B12 and methylfolate, or, most people know folic acid, which is synthetic, but you want to look for L-5-MTHF, which is just L5-methyl tetrahydrofolate. That's the active form that your body can readily use. Leafy greens has dihydrofolate, which is a precursor to that, or you can supplement with it directly. And both of those, along with B6 and really an entire B complex to help lower homocysteine. And so you're getting a lot of things. I mean, B vitamins are involved in liver detoxification, energy production, but also brain health and cardiovascular health.
And do you find, Dr. Tim, that because I find that so many people are deficient in their B vitamins. So is that something that you find in your practice?
Yeah, absolutely. And, the thing is, most of the time people, for example, if they want to check B12, they'll check serum B12, which means absolutely nothing. In fact, usually the rule is high in the blood, low in the cell. So people will say, oh, I'm good with B12. My levels are actually high. And I say, yeah, because, the true marker that you want to check is called MMA, or methylmalonic acid. That is the functional medicine marker that can be checked, through almost any lab to tell you your actual intracellular tissue levels of B12. One interesting point to make is that they've also found the higher your B12 levels, the slower your brain ages. And if you look at the reference ranges in Asian countries, especially Japan, the reference ranges are much, much higher. And so there's never been any recorded adverse events to vitamin B12. And so, you want to take it ideally with the other B vitamins. But if you're going to take it alone, one quick tip for people is to make sure you're getting enough potassium, because supplemental B12 can deplete potassium. And most people are already kind of deficient in electrolytes. So you can either take a potassium supplement, coconut water, which sometimes can have too much sugar, bananas, but you want to make sure that potassium stays high.
Yeah, that's a great point. How do you like to test for do you do any of the micronutrient testing for that?
Most of the micronutrient testing I found, for example, if it says you're low, then you're definitely low.
Right.
But if it says you're sufficient, I've cross-referenced it. For example, I'll just say the test, the Nutri-Eval test from Genova. And it'll say this person is fine for magnesium. But then I'll check their RBC, red blood cell magnesium levels through LabCorp, and it'll be suboptimal. And so, you have to.
Interesting.
It's just experience and, learning how to interpret labs, and also keeping in mind when you're reading labs, well, where did they get the reference ranges? For example, one stool test that I use, they got their reference ranges from 100 of their employees. Well, I don't know how healthy their employees are. I mean, their employees could be pretty sick, so you have to keep that in mind, and then, kind of take your experience and take some information from the research and put it together.
And I think for the listeners, if it's sounding a bit confusing, then you can work with someone who can help you with that. I think the big thing to know is there's other issues that can be affecting your bones and your overall health. And most people are deficient in their B vitamins. I think that's the big takeaway. And it really affects all aspects of your health besides just the bones. So sometimes taking the supplements can really be life-changing. It's unbelievable that sometimes these little things can make huge differences in your health.
Yeah, and I mean, if you look, when I was getting my doctorate, I remember being taught that, unless you had, pernicious anemia or something of that nature, then you really didn't need supplemental B12. And, that's just not true, because if gut health is compromised, your digestion is compromised, sometimes even taking the supplements may not give you an optimal level of that vitamin or mineral. And so, that every nutrient that we take in, has to go through the gut with the exception of oxygen. So if there's inflammation in the gut or an imbalance of bacteria, then that can affect absorption.
Yeah, why don't we go there next? Because the gut is so important. It's beyond important. I think that's probably one of the biggest things I see is that, someone comes to see me and I would say the majority of people I see have issues with their gut. As the majority, it's just very prevalent that people have issues and don't even know about it. But,
right.
if there's an issue with your gut and you're not absorbing your nutrients, of course it's going to affect your bones. So it's just something that we know people who have serious gut issues have lower bone density, but people don't realize that, maybe that they're constipated or whatever issue they may have has major, major impact. So why don't you adjust that a little bit?
Yeah, so typically when we talk about gut health or the microbiome, which is just, the bacteria in our digestive tract, and typically that's referring to the large intestines, because that's where 99% of the bacteria should be. The small intestines should be relatively sterile. So, you have lactobacillus, bifidobacteria, other genii of bacteria that should be there. And an important thing to note is a lot of times, everyone is concerned about taking antibiotics, that might kill off, an entire genus of bacteria, but that can also happen with nutraceuticals. For example, an example is, people oftentimes take Berberine to help balance blood sugar. Well, too much Berberine, especially for an extended period of time, will decimate different species of the gut. And once that genus is gone, you can't get it back unless you're doing a fecal transplant. And so the take-home message there is that, whether it's natural or prescription, there can be negative consequences of using things inappropriately, in too high of a dose or too long of a period, an extended period of time. But when we talk about, good and bad bacteria, there are different tests, some more accurate than others. I used one called the GI map, which is a DNA-based test, and it looks not only at the good bacteria, but it looks for the presence of bad bacteria, protozoa, parasites, things like Prevotella, Streptococcus, Staph, Klebsiella, which, as an aside to the orthopedics part, 74% of people with rheumatoid arthritis have Klebsiella in the gut. Dr. Jeffrey Bland, found that. And so a lot of times people present with, certain symptoms here or there, and they might not, have constipation or diarrhea or even stomach discomfort. But I tell them, trust me, let's test it and see what's going on, because, just the world we live in, the things we're exposed to, not just chemicals, but, emotional and mental stress will affect your gut health and the bacterial levels there.
And let's even take that one step farther. So how is that bacteria in the gut going to affect their bones?
Yeah, so all the vitamins and minerals that, well, first of all, certain good bacteria produce some of the B vitamins and some vitamin K. A lot of times those bacteria are killed off from antibiotic use, whether it's prescription or from compounds like glyphosate, which is in Roundup, which, you see on commercials now. It's been known, we've known it in functional medicine for years, causes cancer, but it will decimate the good bacteria in your colon. And if you have an overgrowth of bad bacteria in the colon, basically, without getting into too much detail, you get certain compounds released into the bloodstream that can affect the brain and basically put the brain on fire, causing, dementia-like symptoms, chronic fatigue-like symptoms. So the gut, and the different species of bacteria or protozoa or yeast, most people have heard of candida. Those can release compounds into the bloodstream that can lead to autoimmune issues.
Which will then, in turn, affect the bones and reduce bone density. Exactly. Can I just comment on something? I just think you've brought up something so interesting, because berberine, everybody is really promoted as a wonderful, wonderful thing to take to help with blood sugar regulation, and it's very effective. And so what would be your recommendation then if someone is on that and they're using it, and they're using it very successfully for their blood sugar? What would be your recommendation to take in addition to offset the possible complications?
Well, making sure their red blood cell or their intracellular levels of magnesium are optimal, which, on LabCorp, you'd want it to be 6.1 or higher. That's extremely important. Magnesium improves insulin sensitivity, so that will help to balance blood sugar. There are a zillion other compounds that can help. There's a supplement called D-chiroinositol that doesn't have any impact, to my knowledge, on the microbiome or the gut bacteria, and it is very effective at balancing blood sugar. There's alpha-lipoic acid, which should be taken with biotin, but that is an antioxidant that helps recycle vitamin C, vitamin E, and glutathione. But it is extremely effective at balancing blood sugar and improving insulin sensitivity. And so, those three compounds right there don't have any negative impacts on the microbiome, but they're also extremely effective at improving blood sugar balance.
Okay, great. So do you not recommend berberine then, or?
You can use it. I actually use it as an antimicrobial for killing some of the pathogens in the gut. I would say, just probably a lower dose, like keep the dose for the total for the day, maybe around 500 milligrams, not go above that. Another common supplement that doesn't really have to do with blood sugar, but is quercetin.
Yeah.
Quercetin, if you go over a gram or 1,000 milligrams a day, that can have negative effects on the microbiome. And so, it's, a lot of people come to me and they think I'm just going to say, oh, everything all natural. Well, it's not really, that simple. It's just the misuse of prescriptions and also the misuse of supplements.
I love that you're bringing that up, because people do think that more is better. That's a big, big thing that I see all the time. Oh, if this helps, let's just take more of that, and that will really help my bones. And I love what you're saying, that can actually have a negative effect on the microbiome, which is then going to in turn affect everything, including our bones. So those are really helpful points. Now that we're saying the more is better, let's hit, this is what I see the most in my practice. The most that people think more calcium is better. So why don't we hit the calcium? Why don't you tell us your thoughts on is more better? We know the answer. Why don't
definitely not. And I can open my textbook of pathophysiology, and it'll say for osteoporosis, 1,500 milligrams a day of calcium. But then you open the cover of the book and it says sponsored in part by Pfizer, sponsored in part by Merck. So, you take it with a grain of salt. When you do that, a couple things. Vitamin K2 is like a little molecular taxi that takes calcium and escorts it into the bones and into your teeth where it's supposed to go. If you're just supplementing with calcium, all you're doing is calcifying your arteries. which you don't want. That's a bad thing. But you're also skewing the calcium-magnesium ratio, and magnesium is the most common mineral deficiency to begin with. And so you're taking an imbalance, and it's already here, and you're taking it here. And so one thing I'd love to point out is that, if you look at the epidemiological data, the countries where women have the highest calcium consumption, they also have the highest rates of osteoporosis. If you really want to, balance your bones, and I know other people have hit on this, so I won't take up too much time, but vitamin K2, we mentioned off air, I have a colleague that showed me x-rays of a female, I think she was 62, and all he did was add vitamin K2, and he showed me x-rays a year later, completely different. I mean, you look like a different person almost. And that's just vitamin K2. But, silica is important. And I don't know if you want to get into it now, but the hormonal part, especially along the lines of testosterone, is extremely important.
Let's stop for a minute and delve into some of these, because most people are not on K2. Most people, when they go to the physician, they're told to have calcium. And the good thing is, I was even last year at the National Osteoporosis Foundation, food first. That get your calcium from food first. And even physicians, everyone now believes that. Food first, and only if you're not getting enough in your food would you even think of supplementing with calcium. But food first for that. But the calcium, just like you said, we absolutely must, if you're just taking calcium. Oh, and vitamin D, that's definitely recommended by all doctors. So most people I see have calcium, vitamin D, and they are exercising. I have to say, physical therapists, physical therapy is a part that's recommended, that people know that's important for osteoporosis. But usually that's it. So I think something to take away that I know other people have talked about, but we can't drill it in enough. If you're not taking K2, or you can sometimes get some from food as well, but most people don't. Natto is the big thing. It's a Japanese food that's tons and tons and tons of K2. But most people don't like the taste of it. It's sort of slimy, but most people will need K2, and magnesium is critical. So we can K2
and magnesium, absolutely. You need to supplement with, no matter if you're eating 100% organic. It's just, unless you're eating a lot of organ meats, you're going to be deficient in some of the fat-soluble vitamins, A, D, E, and K. And to your point about vitamin D, I've evolved a lot. I'm really big into balancing circadian rhythms. Mm-hmm. And getting your vitamin D from sunlight. And if you're somewhere like New Jersey, then you can invest in a vitamin D lamp, which, it can't completely replace or mimic all the effects of the sun, but there's so many different reactions I won't even get into.
No, you know what? Please do, because that's something that I don't use a vitamin D. Let's just tell everyone what the vitamin D lamp is.
Yeah, so vitamin D lamp, there's one, and I have no affiliation with this company. I just know that it's a good lamp. It's called Sperti, S-P-E-R-T-I. And it's good to use during the winter months, especially if, you're somewhere in the Northeast or Northwest or Minnesota. Then, you want to get exposed early in the morning to that blue light. And the earlier in the morning, within the first 2 hours of waking up is the best time to get exposed, because you're not only getting blue light, you're getting red and near infrared light as well, which a lot of people, don't know about, but they have tons of beneficial effects on the body. And the most important thing is you're getting vitamin D sulfated, which is activated vitamin D when you get it from the sun. And so within the first couple hours of waking up, and then in the evenings, right before the sun goes down is a good time. You can certainly get it during the middle of the day. You're just not getting as much red and near infrared light. And, everyone will ask me, well, how long can I stay out? You want to expose as much of your body to direct sunlight as you can. I mean, my friend, neurosurgeon Dr. Jack Cruz, he recommends that you roll around naked in your backyard to get sunlight, because you're not only getting sun or vitamin D, you're also grounding, you're adding electrons to the body, which all that means is you're adding energy. And so the sun and sunlight, I mean, it's one of those things that people overlook because, you know, if they spent $70 on a supplement, they're going to make sure they took it or take it because, you know, they got to justify it in their mind. But, you know, getting sunlight is free. And, you know, the stats show that we spend about 90% of our time indoors in front of artificial blue light, which is actually detrimental to a part of our bodies or part of our cells called the mitochondria. Whereas natural blue light from the sun energizes our mitochondria. And anytime you can make those mitochondria, which are just the batteries of your cells, if you can make those work better, everything in your body will work better.
You know, that's you brought up so many good points. With the I have personally found, because I do online classes and I've been doing all sorts of things, and so my time with my computer has just gotten to be so much more, and I found it really affects me. I never realized it, to the point that I have to stop because I've seen such a difference in just how I'm feeling because of which is silly because I just started a happiness course. So who would think a happiness course, being on the computer more to create it, is actually making me feel less happy now.
Right.
It's pretty much, it's done now. And so all the serious computer work is done, but it was so crazy. But no, I think that's a good point because this is a society and the time in our lives, so many people live on the computer and we're there 24/7, and we just getting outside and getting back in nature is going to make such a huge difference. But this vitamin D lamp, are there any negative consequences with your skin? Because I know people, that's one thing people are very afraid about with cancer, skin cancer, and, all of that. That's like definitely an issue.
I mean, so if you look, as the rates of sunscreen have increased, the rates of skin cancer have gone up. If you look at the ingredients on sunscreen, a lot of times there are these nanoparticles, which just means they're really, really tiny. And if that were a nutrient, say a mineral or vitamin, that would be good. It would mean it's smaller, it's easier for it to get into your cell. But it's a chemical, a synthetic chemical. And so you don't want it to get into your cell. A friend of mine, his ex-wife is a dermatologist, and she said, after that 30-minute period, coconut oil, she recommends. And then I think there's some essential oils. I'm not an essential oil expert, but you can mix those with the coconut oil for good sunscreen. But yeah, any of the synthetic sunscreens, you want to avoid. You don't want any of those nanoparticles, any long chemical names, dihydro-3,4-benzene acetate, like that. If you can't pronounce it or you don't know what it is, then you don't want it in your body, because what goes on your body goes in your body.
Yeah, I think that's a really good point because, we think we're blocking the sun, but there's so many chemicals. And so I think a good resource for people is just the Environmental Working Group. They've done so many studies, and they've actually rated all the suntan lotions in terms of what chemicals they have in them. So it's just, if you go to EWG, and it's called, I think what it's called, the sun. It's obvious on their site, the Environmental Working Group, but they've done a wonderful job with evaluating sunscreens, and because don't just throw it. Really, really don't think it's not a big deal because your skin absorbs, and so when you are lathering this on you, you're really causing. You could be getting all sorts of chemicals entering your body, and you're trying to help yourself. How silly is that?
I recommend that people, especially females, run all of their personal care products through the Environmental Working Group, which is ewg.org. For example, I was showing my niece, she uses Proactive for acne, and there's 15 carcinogens in it. And this is not, like someone saying, I think there's 15 carcinogens. These are 15 proven carcinogens. And so, you can run all your products through there and get a printout of the different chemicals that are in them and the potential side effects.
That's such an important point because when we're talking about the bones, just like every part of the body, It's the load you're putting in. You know, the body can detoxify and it can handle some because that's the world we live in. But once we overflow, once we fill up our cup with toxins, then everything becomes affected. And we start having issues with our bones, our joints, our, you know, every aspect. It's really unbelievable. And it's overwhelming. I know if you're listening, you're like, oh no, not another thing I have to do. And my feeling on all this is you do one small step at a time. You know, you start with your lipstick and start with, you know, because that's the one that gets, you know, you start slowly, but it's doable. And there's great companies that have fabulous skincare products that are wonderful, and they don't have the chemicals. And we're not going to go into all that now, but it's, you know, I mean, offhand, there's Anne Marie's, there's Beauty Counter, there's the Spa Doctor. So there's lots of them. And I'm going to have people also on this podcast as well that goes into more detail. But it's a good point because it all affects our health. And
Absolutely.
Yeah. And so we don't have that much time left, but let's maybe just get into what else would you want? What would you like to enlighten everyone here to? The biggest things that you've seen that impact the bone that can have the biggest takeaways.
I think hormonal health. You know, people are so focused on minerals, and those are important, you know, everything we've discussed so far. But one hormone in particular that gets overlooked is testosterone. And particularly in women, you know, everyone immediately, when they hear testosterone, they think, oh, libido, oh, you only need that if you're young. But testosterone affects so many different parts of your body, particularly bone density, heart health, brain health, energy production. And, you know, I have women in their late 20s, early 30s who have low testosterone through different pathways that we won't get into. But, you know, you want to have your testosterone checked, your total testosterone and your free testosterone. And that's, you want to keep in mind when you're evaluating it, that you want it to be towards the top of the range. So just to give an example from the male perspective, LabCorp's testosterone range is 200 to 850 or 900. Well, if you're around 850 or 900, you feel great. If you're around 200, you're probably in the psychiatric ward because you're depressed. But yet both of those people are within range. So you can see how silly that is. And the other thing to mention is, you know, if you look at the trends from, you know, 5 years ago, 10 years ago, 15 years ago, you can see the reference ranges going down lower and lower and lower. And so you really want to work with someone who understands optimal versus normal. Normal is Homer Simpson. You don't want to look like Homer Simpson. You know, I see women, you know, focusing on progesterone, which they definitely need because that drops drastically during menopause and you become estrogen dominant. You know, estrogen or progesterone drops around 75%, estrogen drops around 35%. So estrogen, it becomes dominant, and that has a whole host of negative effects, including negative effects on your bones, but also testosterone. And that's not just for libido, but, you know, for all the other effects that I mentioned, such as the heart, the brain, and those batteries in your cell. Testosterone will impact that. And so, you know, minerals, diet, sunlight, and, you know, just getting outside, reconnecting to nature, some of the things that are easy and free to do, and balancing your hormones. You know, it's important, I think, for people to distinguish between synthetic hormones like progestins versus progesterone, which is, you know, natural compounded. And when I say compounded, you know, those are pharmacies where pharmacists actually take the ingredients, you know, they have the formula, they make up the substance, and then boom, you have your gel, your cream, your troche, whatever, versus, you know, going to CVS and getting a progestin, which is a synthetic progesterone. And a lot of the studies that you see where it says, oh, you know, these hormones cause cancer, well, then you read the study and you realize it's synthetic. And so that's an important, you know, difference to make or distinguish between.
Yeah, so that's great. So there's so many things that we've discussed, and I think what's important is don't be overwhelmed, because the good news is that there's a lot you can do. To me, that's the whole thing with osteoporosis. I look at it as a reset. You know what? Okay, you're at a certain age, you find out, but then when you make these changes that are going to help your bones, they help everything, and you live longer, healthier, happier. So I always look at it as a win-win. It's like, okay, let's see, let's discover, let's test. But I think it's important with hormones that people work with someone who's really knowledgeable, because it's not something you can really do yourself. It's something that, you know, you need assistance with. So
Right.
all
Right.
good stuff. So why don't you tell us, because you've enlightened us to so much, how people can get in touch with you if they want to learn more and see all the work you're doing?
Yeah, my website is healyourbody.org. So that's healyourbody.org. You can email me through my website, or my direct email is drtim, as in Dr. Tim, and then 072981@gmail.com. And so Dr. Tim 072981@gmail.com. And if you want to mention the code or put in the subject of the email, Happy Bones, so that I know you were referred, you know, from the summit, that would be great. And I'm offering $150 off on one of my programs called the Heal Your Body program. And so if anyone is interested or needs help, they can reach out to me and use that code, Happy Bones.
Oh, thank you. That's very nice of you to offer that generous offer. And you're a person, as I said, as I'm sure all the listeners are agreeing, a person that knows so much about so many things. But the good news is that you put it into practical use, so you help people get better. And I think that's what we're all here for, because we all want to feel good. Yes, we may have found out that we have lost some bone, but now we're on it. What are the causes? What are the root causes? We're not just going to cover up. We want to do everything we can from the inside out. And as both you and I have seen, when we do that, the funny thing being physical therapists, we see physically that people get better when they've just worked on internally as well as emotions, etc. So it's an
Imagine that.
it's an interesting perspective to take when you start out, as we have, as physical therapists, working structurally with people. And then when you add all the other components, even like I teach happiness, even seeing when people get happier, all of a sudden their muscles change. It's just amazing. So all the things you do with internally helping people, then we see the results in their bones, so in their muscles and how they feel. So
Absolutely.
So I can't thank you enough. And it's been really a pleasure, and hopefully we'll get to stay in touch and do more of these, because I love speaking with you. I learn things every time. I'm going to look up that vitamin D lamp right now.
Thank you for having me. I appreciate it. I hope I gave some useful and actionable tips to your listeners.
Oh, I think you gave lots of things. I think people are going to listen to this again and again, because there's so many tips that you did give. So thank you so much, and I really appreciate it, and it's been really fun. So see you soon.
All right. Bye-bye.
Bye.
I hope you enjoyed our time with Dr. Tim as much as I have, and have some new knowledge and take-home tips that you can put into your life. All the links that Dr. Tim talked about are in the show notes. So bye for now, and I look forward to seeing you next time. Thank you for listening to this episode of the Happy Bones, Happy Life podcast. If you enjoyed this show, please subscribe on your favorite listening app so that you don't miss any amazing insights on upcoming episodes. And until next time, continue to live your best life ever. See you soon.